Thank you for listening to Depictions Media Radio.
Protective equipment, and even oxygen. We face the same challenge today with vaccines. Manufacturers are working around the clock to produce more doses, and new vaccine candidates are being reviewed and included in the WHO emergency use listing, so that more vaccines will hopefully be available soon. But we expect that the world will continue to face a shortage of vaccines for much of 2021. There are simply not enough vaccines to go around right now, and the limited amounts that are available are not being distributed equitably. Wealthy countries are rolling out vaccines, while many nations have yet to receive a single dose. This disparity harms our principles of solidarity, but more than that, it is a self-defeating strategy. As long as COVID-19 endures in one part of the world, the rest of the world can never be safe. And the longer we allow virus to spread, the greater the risk that more dangerous variants emerge, which could complicate control efforts. And so that's why it's vital to accelerate access to vaccine doses for all countries, not just the ones with the most money. And we must pay special attention to the countries that are the hardest hit by the pandemic, because many of them remain the most vulnerable. Just this past week, the Americas accounted for 55% of the deaths reported worldwide. Despite being the epicenter of the pandemic, the region of the Americas lags in vaccination efforts because most countries cannot access the doses that they need through bilateral agreements with their manufacturers. Expanding equitable access to COVID vaccines in the Americas must therefore be a global priority. PAHO is committed to ensuring that our region receives the doses that we need as quickly as possible. In the meantime, our member states are ready to roll out these vaccines, and PAHO stands by to give any support that they need. And just as vaccines should not breed further inequality between countries, they should not also widen the divide within countries. These life-saving vaccines should not be a privilege for the few, but a right for all.
Muchas gracias, doctora Etienne. Vamos a comenzar ahora entonces con sus preguntas. Recuerden cuando nos escriban las preguntas por el QIA, incluir su nombre y el medio.
We can receive your questions through the Q&A button and also listen to them. The first question is by Adriana Brasileiro from Miami Herald in English. It reads,
Does PAHO worry that the vaccine challenges in the region, limited supply and distribution issues, will exacerbate underlying inequalities and delay even more the control of transmission of the virus in Latin America? Doctora Etienne?
Thank you, Adriana. Of course, PAHO is very worried about equity in vaccine access, and we are already seeing reflections of global discrepancies. As I mentioned earlier, developed countries are vaccinating their populations at much faster rates than middle and low-income countries. In the Americas, globally as well, we know that these vaccines are powerful tools that will help us save lives now and eventually help control the pandemic. But if only a few are vaccinated, many will remain at risk. And this is not the outcome that we are working towards. So now we must do everything in our power to protect those most vulnerable everywhere. And once more vaccines are available, we have to ensure that they are equitably delivered within each country. So that's why PAHO is working on two fronts to prevent inequality from leaving its mark once again. Through COVAX, we are starting to deliver vaccines in the region. Since allocations were announced to countries on Friday, PAHO has already placed purchase orders on behalf of 4 member states, and we are finalizing with others. As soon as vaccines are ready to ship, Honduras, El Salvador, Bolivia, and Nicaragua will get their first deliveries. But many more are underway. PAHO is working virtually with every country in our region to address pending documentation and requirements. As countries are ready, as I've said before, orders will be placed on a daily basis. These shipments are the first of many, and our member states will continue to be supplied as more vaccines become available. The second front is ensuring that each country has a plan in place to protect those more vulnerable. We are ensuring with countries to do that vaccination plans are appropriate and focused on using the limited stock that we have now on those that are more at risk of severe disease. And once we cover these populations, we are encouraging countries to ensure that vaccination plans are transparent and address realities of each context, reaching groups across income and geographic barriers. Of course, this is not new. Our region has ensured equitable access for decades, protecting communities in every corner of the Americas. And we will do it again for this vaccine. But I must remind you that COVID-19 can be prevented for the next several months. We must rely on these measures to protect our people and get individuals immunized in the region.
The next question. I have several questions indeed, because with the arrival of the first vaccines through COVAX in Colombia, and also the assignment of vaccines up to May, as COVAX published, we have several similar questions by Chris Milches from Ecoperu, also from Rodriguez from Uruguay, El Subrayado from Nicaragua, Williams from The Guardian in Bahamas. The questions are basically, when do you expect to have first delivery of COVAX vaccines in their countries, that is to say Latin America or the Caribbean? And we also have questions in connection with details, how many batches, how many doses are going to be sent in each of the batches, and why some countries are going to be receiving the first shipment earlier than others. Dr. Barbosa, thank you very much for these questions. First of all, let me clarify that we have 4 countries in the region that have participated in an initiative led by COVAX that is called First Wave. Those countries were defined WHO by looking into the situation of equality among the regions. So we have 4 out of the 28 that are participating. Those are Peru, Colombia, El Salvador, and Bolivia. Those vaccines are Pfizer vaccines, a very limited number of vaccines to start applying them to health workers. Colombia has already received those doses. Peru should be receiving them, and we are supporting the country to conclude all of the arrangements to be made with the producer to receive the vaccine. That is the first wave. As to the regular deliveries through COVAX, all of the countries have already received the information on the dosage and also the number that they will be receiving up to May in the region. All of the countries do have that information. After we concluded that estimate, WHO Immunization Group and Gavi established criteria to try to identify various regions in the world at random, and they are assigning the vaccines based on groups. 9 countries were sent, whose information was sent last week, were already part of 4 purchase orders that we placed for those countries. Now we have concluded 8 of those purchase orders. Yesterday we received a list of other 9 countries, and we are already working with those countries. What do we do when we receive the information from Geneva for the assignment of the vaccines? We establish contact with the country and the producer to have all of the documentation, import licenses, as well as regulatory measures, so that everything is ready. And that is when we sign the purchase order, and the producer starts with the process of packing the vaccines to be sent, and then the information on the date and the number of vaccines, as well as the
Já concluímos todo o processo e estamos aguardando solamente
are sent to the country. We have concluded this with 9 countries. We are now awaiting information from AstraZeneca for the countries to receive this, and we believe that next week they will be receiving these doses. As to the other countries with which we are working, oftentimes one country or the other needs to conclude one of the stages necessary from the administrative point of view. And we are making all the efforts possible to support the country so that they can directly receive the information on the date, the flight number, and also the amounts. Thank you. Thank you, Doctor. And as follow-up to this question, we
Entre ellas de Paul.
Also related, we have from Paul Kaiser from Suriname, Adriana Santagati also from El Canónico, Karina from Argentina, Jacqueline Videla from El Mundo in El Salvador, and they would like to know what vaccines will be sent through COVAX to the region, who is the producer, and what was the criteria used to determine the schedule for the deliveries, and also the numbers of vaccines to be sent to the countries up to May 2021. Dr. Barbosa. Thank you. Thank you very much for this question. The group working on the allocation of vaccines at WHO decided to apply equality. That is to say, that this is one of COVAX principles. All of the countries are receiving, as part of the first shipment up to the month of May, up to 2.2% of their population. The exceptions include countries that have smaller population, and from the logistical point of view, it doesn't make sense to send them even a smaller amount. So we are sending them about the same amount, but most countries are receiving between 2.2% of their population, and all of the countries received last week information on the number of vaccines to be received during the first shipment. The first shipment through COVAX is using AstraZeneca vaccines for self-financing countries in the region. That is, most of them, the AstraZeneca vaccine that is produced in South Korea. The producer is SK Biopharm, and also the countries in our region that are countries that receive the support of the COVAX facility. That is to say, that do not pay for the vaccine. 3 countries are going to be receiving vaccines by AstraZeneca produced in India. These are the 2 producers that we are currently working with. COVAX is also concluding negotiations with Pfizer to have more Pfizer vaccines available for these months. Johnson & Johnson vaccine has also committed some vaccines to COVAX, but that would be to be delivered in June, most likely. So we have vaccines mainly from AstraZeneca, from the Korean producer SK, and for 3 countries is AstraZeneca from the Serum Institute in India. Thank you, doctor. The next question is by Beatriz Menjivar from La Prensa Gráfica in El Salvador, and her question is, what are the control mechanisms to be implemented by the citizenship and also the country
Doctor Ugarte.
for the vaccines to be for the most vulnerable groups? Dr. Ugarte, thank you very much for your question, Beatriz. This is a question that is a concern for all of the countries of the Americas. The first step is to share the national immunization plan for COVID-19. This is the plan that has been drafted most likely in connection with many other institutions, should be made public. Also, the main agencies from the health sector should be included in this process, as well as scientific associations, so that they can monitor and support the implementation of the plan. This also implies monitoring all of the technical, operational, logistical aspects, as well as information on the administration of the vaccine to vulnerable groups. It is also necessary to have independent monitoring mechanisms to be able to identify any diversions from the standard, so that adjustments can be introduced timely throughout the processes. These processes, the populations need to be informed of vaccination places, the timing, and also how the population can be vaccinated. In some cases, make an appointment, and this should be easily accessible for those who do not have access to internet, for example, and that information needs to be channeled through health services by using their network and any other communication means available. It is highly important to recall that the various types of vaccines that are being administered in the countries are effective enough to prevent deaths due to COVID-19. Therefore, these communication processes, monitoring processes, as well as review mechanisms are important, and they need to be shared with other organizations and agencies to make sure that they are transparent and also adhere to the quality principles that were established at the outset. Thank you. Thank you, doctor. Now I'd like to give the floor to Jacqueline Charles from Miami Herald for her to ask her question. Jacqueline Charles.
You have the floor. You're listening.
Yes. Good morning. Thank you. With the vaccines from COVAX arriving in the region, how much an issue is vaccine hesitancy? How strong is the anti-vax movement? And what is the plan to getting people to accept the COVID-19 vaccine? I'm also curious if you guys have done any studies on this issue of hesitancy as it relates to COVID-19 vaccines. Thanks.
Thank you, Jacqueline. Y también en ese sentido, sumo la pregunta de
Thank you, Jacqueline. And I also have the question by Steven Serial from PJ2 in St. Martin. And he wants to ask
your advice to the persons who are still of the opinion that the vaccines are not safe. Dr. Aldiguieri?
Yes, thank you and good morning, Ms. Charles. And thank you for this important question. I would say that maintaining the population trust in immunization is critical at all times, and PAHO is working on it for decades, but especially during the rollout of a new pandemic vaccine. It's why we are supporting activities to implement activities that will help to grow and maintain the trust in the vaccine. In the Americas, we have a context, I would say, of wide acceptation of vaccination for children in the Caribbean and in Latin America, including, through the organization every year of the vaccination week for the Americas. But also in this region, which is very special in terms of immunization, we have a lot of experience vaccinating high-risk groups in adults for influenza. This includes healthcare workers, older adults, pregnant women. But also, we have to take into account that the reasons for hesitancy are often very complex, context specifics, and sometimes culture specific. So we have to work with countries and partners to understand why people may not be motivated or willing to accept or seek vaccination. We have also advised the countries, our member states, to really characterize the perception of minorities, including Afro-descendant populations, including indigenous communities. This is really a key aspect of how we have an idea of the landscape in terms of hesitancy. But what we are facing is that misinformation about COVID-19 vaccine has been circulating even before vaccines were available. So our objective is to correct this misinformation with clear messages on how the vaccine is crucial to decrease the number of hospitalizations and the number of deaths. But also the real-time communication on the impact of the vaccination in other parts of the world is also crucial. The best examples at this moment are the impact of the vaccination in Israel, in Scotland, and the United Kingdom. And to explain to the public why, and to the adult public, why it is so encouraging to see the real world data on how the vaccine is effective and will be effective to prevent death and to prevent hospitalization, including in intensive care units. So we have ongoing studies. For example, in the Caribbean, results are being analyzed at this moment. We have special studies in some specific countries regarding healthcare workers. But I would like to make more general comment and highlight that PAHO will support countries to design, to implement, and to evaluate a mix of tailored strategies, tailored to the country-specific reality, to respond to vaccine hesitancy. But also we have some transversal line of work, training the healthcare workers to be ready and able to recommend the vaccine. The healthcare worker is the first person to dialogue, to speak with a person seeking vaccination or having concerns, and also to the community. Engaging leaders, community influencers to build trust in vaccines, and also listening. I'd like to highlight again, listening and understanding different population groups, and I have already flagged some of them. So I hope I have answered the questions/concerns of Ms. Charles. Over.
Gracias, doctor.
Thank you, doctor. Another question regarding the International Women's Day, which will be next week. We have a question in English.
The gender dynamics of the COVID-19 pandemic. Dr. Etienne?
So thank you for this question, and it's an important issue, especially international women on the core piece. Indeed, women are playing a multifaceted role during this pandemic. They are delivering health services to COVID patients, but other essential health services. Simultaneously, they must be caregivers at home. They must take care of their families, and very often they are the breadwinners. So women are doing all of those simultaneously. Also, women are on the front lines of this pandemic. Globally, some 70% of all health workers are women. And in Latin America and the Caribbean, 9 out of 10 nurses are women. And that means that women are the heart of the pandemic. And many of them have become ill themselves with COVID-19, and many have died. So therefore, we believe that they must be at the center of the response at all levels. Women's leadership in and for health will accelerate gender equality in the context of COVID-19 and beyond. And we insist that our healthcare workers are priority number one in receiving the vaccine. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. Next questions from Ecuador, from Maria Largacha, from Coavisa in Ecuador. She has a question from Televicentro in Ecuador. They have similar questions regarding the opinion of PAHO about the government initiatives of provincial governments or the private companies who want to purchase vaccines. What are the criteria for these other agencies, either municipalities or sub-regional or private enterprises that want to buy vaccine?
Mira, cada país tiene su propia ley.
Thank you very much for your question. Each country has their own laws, their own regulations, but in general, immunization programs work better when they have central coordination. We understand that everyone is anxious to have the vaccine. COVID-19 is a very important emergency, not only health-wise, but also because of its social and economic impact. But even in those situations, to begin to look for different manufacturers, different vaccines through local governments, through private companies may be a challenge for the overall coordination of the process. Our immunization programs in the region in general are coordinated by the health ministries. Is the best way to guarantee that the national immunization plan can be implemented appropriately, prioritizing priority groups such as those groups that are at highest risk of contracting infection, such as health care workers and groups that have more vulnerability for the most serious forms of COVID-19, elderly, as other adults with chronic conditions. The best way to respond to an emergency is by responding in a well-coordinated fashion. If you have good coordination, I think, if you don't have good coordination, you may be having people trying to buy here and there. You will end up vaccinating people who don't need to be vaccinated because they don't have the vulnerabilities, and then you may contribute to increase the inequities in the country. So we're working with governments, with ministries, to broaden access, an access that is equitable to the COVID-19 vaccine. And maintaining good coordination is the best response that we can give and have at this point in time. Thank you. Thank you, Doctor. From Sara Batista now, from Brazil. First question is, what is the evaluation of PAHO of the pandemic situation in Brazil? Dr. Aldigueri, please. Yes, thank you very much for this question about Brazil and from Brazil about the situation of the pandemic there. At this point in time, Brazil has reported more than 10 million cases accumulated and more than 250,000 deaths. It is the second country most widely affected in the Americas. For the last 3 months, we saw a second pandemic wave that started in the northern part of the Amazon basin in Brazil, including the state of Amazonas, and it has spread to other states in the northern area, Roraima, Rondônia, and Acre recently, which Dr. Etienne mentioned in her initial comments today. Acre has had to declare an emergency situation. With reports from the health secretariat in Brazil, we can see zones of high transmission in other geographic areas of Brazil as well, especially some states in the northeast, as well as in some states in the south of the country. I would say that Brazil at this point in time is confronting a second wave of the pandemic, which is nationwide and which is impacting their health services, including ICUs and the rate of occupancy of beds in ICUs in some states. I would also like to stress what we saw in recent weeks, an important impact in the chain of in the supply chain, as with oxygen and access to special medicines who are for patients who are in the ICU. So it is key to reduce transmission in Brazil, as well as in other countries in South America. We also heard from Dr. Etienne referring to this, to save lives and to control dissemination of variants of the virus. This is a very significant issue. And so strict implementation of public health measures is key, as I was saying, in the current context in Brazil, as well as in other countries in South America. I hope that I have answered your concerns and questions from the journalists. Thank you. You said something about variants, but yes, the journalist asked about how significant the dissemination of other variants is in the region. Yes, of course, this is a concern at global, national, and regional and sub-regional level at this point in time. Up to yesterday, 28 countries and territories in the region of the Americas had reported the presence of at least one variant out of the three high concern variants at world level. 8 countries and territories of North America and South America yesterday had reported the P1 variant, which was initially described in the north of the Amazon basin. It's important to say here that the dynamic of transmission of the P1 variant being characterized, and there have been several publications that give us some evidence done by several groups of researchers. Scientific research is ongoing. An important aspect here is that broadening of genomic surveillance of SARS-CoV-2, which is the agent of COVID-19, is critical because of the potential impact of the variants in the transmissibility of the virus, and also potentially impact on vaccination campaigns that are underway at this point in time and that are getting started in our region. So WHO is strengthening and supporting the strengthening of the national network of genomic surveillance, and it will continue to detect new variants and work on detected variants. And of course, we are expecting to see other variants emergence. So this activity of surveillance network to share information on real time is one that is at the top of the list of priorities of PAHOs at this point in time. It is a very important list of priorities, and this one is at the top. What is important to also mention here regarding transmission of new variants, as asked by the journalists, is that the keys to control are the same, whatever the variant in circulation. It's again implementing, strictly applying and implementing public health measures using a mask, hand hygiene, social distancing. The implementation of these measures allows the programs to initiate, maintain, and broaden their activities. I think these comments are applicable to all our subregions in the Americas. I hope I have answered your concerns. Thank you. Thank you, Doctor. The next question is from Michael Clocks from Depictions Media in English.
Since the AstraZeneca vaccine is found to be less effective for those over 65, what effect will this have on the immunity in the Americas? Doctor Barbosa.
Thank you for this question. The last 3-4 weeks, I don't know, we had many questions about the efficacy among different vaccines. Let's remember that the data that were released 1 month, 2-3 months ago, when the vaccines were requesting license to be used, were data provided by the phase 3 clinical trials. These were data about around 30, 35, 40,000 people, the volunteers that participated in the phase 3 clinical trial. Now, we have data from the real life. So this week, the Public Health England, that is the public health agency in the United Kingdom, released a very important document comparing the two vaccines, the vaccine from AstraZeneca and the vaccine from Pfizer, in 7.5 million people with 70 years and more. So now we are not talking about efficacy. We are talking about efficiency, because this is real life. And the conclusion of this document is that both vaccines provided similar protection for people with 70 years or more. So I think that this is important to reassure that the vaccines that are pre-qualified or received emergency authorization by WHO are safety vaccines and can be effective to protect people, including the elderly, against COVID-19. So AstraZeneca is not less effective. AstraZeneca is similarly effective to Pfizer and other vaccines and should be used to protect the people that are more vulnerable to COVID-19 and severe forms. Thank you.
Gracias, doctor. Siguientes preguntas.
Thank you, doctor. Questions now about Venezuela from Mariana Soque from Efecto Cocuyo and Consuin Barrios from Alegría Noticias. From the chat, they both ask whether we can give an update of the situation of vaccine access in Venezuela through COVAX, if the country can still have the possibility to receive vaccines from COVAX. Dr. Ugarte, thank you for your questions. Several meetings have been carried out where opinions have been exchanged by the Ministry of Health, but also by experts from the National Academy of Medicine and the Epidemiology Association and others. And several experts have been involved in the working groups for the National Immunization Plan. And during those meetings, they talked about the arrival of other vaccines, Sinopharm and Sputnik. However, we do not have detailed information or an updated report about the situation. According to the plan, there are about 340,000 health workers that would be a first priority for receiving the vaccine. And in this sense, regarding availability of vaccines through the COVAX facility, once Venezuela makes the initial payment for the vaccines, undoubtedly they will become part of the group and will be receiving announcements of deliveries. And right now they are debating these processes, and progress has been made regarding the amounts and that are needed, the processes that need to be followed, and also how to implement the immunization plan once the vaccines arrive. And this is as much as we can tell you right now. Thank you, doctor, for your answer. Next question is from Daniel Rodriguez from Subrayado, Uruguay. Given the delays in delivering AstraZeneca vaccines through COVAX in Latin America, have you thinking of buying other vaccines to accelerate the delivery process, Dr. Barbosa? Thank you for your questions. We are in this process. It doesn't make sense to stop one negotiation and start negotiating with others. We have manufacturers that have been pre-qualified or have received emergency use authorization, we can not just go out and start buying other vaccines. And we do not recommend buying other vaccines that have not been certified for safety and efficacy. And so we don't recommend you go out and buy these from these other manufacturers. So we have the Pfizer vaccines that are in the process of finalizing negotiation, and we will have a small amount of 40 million doses for the first 3 months, March, April, and May, and there will be more doses. And with AstraZeneca, our negotiations have been completed. Now we are working on logistical arrangements. So we are talking about millions of doses of vaccines that the manufacturer has to package appropriately to transport the vaccines and make the deployment. We consider then starting next week, we will have vaccines arriving through COVAX, and we are in conversations with the country, with the manufacturers, so that the vaccine can arrive. So we think that the most effective thing right now to make sure that vaccines arrive more quickly is to work with the countries the way we are doing and have been doing so far, working on a daily basis, so that the countries may complete all the steps they need to follow and complete. Each country needs to make the regulation measures, import licenses, and there's a series of steps to receive the vaccine. At the same time that we're working with the manufacturers to accelerate the process of preparing the packaging and transportation of vaccines to the countries. Thank you, Doctor. The next question in English is from Sarah Newby from Telegraph.
Cuba is developing its own vaccines. How important is this for the Latin America region more broadly? And if clinical trials prove effective, do we have any time to scale for when these vaccines may be available? And has Cuba agreed any deals to help supply vaccines to the rest of the region? Doctor Barbosa, ¿podría contestar?
Yes, thank you. Thank you for the question. We welcome any vaccine development in Latin America and the Caribbean. This effort from the Cuban government is indeed very, very, very relevant for the region. We have other projects that are being developed in other countries, in Brazil, in Peru, at least from these 3 countries. We have received information that they are developing projects for COVID-19 vaccines. The Cuban vaccine that is more developed, the Soberana 2, is starting the phase 3. So we need to wait. Now, we cannot make any kind of arrangements, because a vaccine to be purchased through the revolving fund, and any vaccine produced in the US, Canada, Europe, Cuba, Brazil, Russia, China, in every country, they need to comply with the same requirement. They need to finalize all the preclinical and clinical trials, and after that, they need to present the dossier to show the quality of the production, that the vaccine is safe, that the vaccine is efficacious. So the pre-qualification team in WHO Geneva can make the assessment. So at this moment, we can only welcome and to encourage Cuba and all the other countries in the region to try to develop vaccines, but they need to accomplish with exactly the same requirements that are presented to all producers that can offer vaccines to the revolving fund to be purchased on behalf of the countries in the Americas. So we need to wait the phase 3. It probably will take 3-4 months. We don't know. After this, when the producer, Instituto Finland, has finalized, and if they want to be pre-qualified, they need to present all the data, all the dossier with the information to be assessed. Thank you.
Gracias, doctor. La próxima
Thank you,
pregunta.
doctor. Next question on the chat is from Lidia Lopez from La Prensa in Nicaragua. And it says this Tuesday they started vaccination in Nicaragua for a group of vulnerable people, but it does not include health care personnel. And so it wants to know what recommendations can be given to the population who already have received their first dose, if there are special cares for them. Dr. Ugarte, thank you for your question. Yes, in fact, Nicaragua has started to give the vaccine according to their priorities. It includes people who have chronic conditions and who are at highest risk of dying due to COVID-19. We understand that each country has defined what their priority groups are, and the healthcare personnel is also included among the priority groups. The amount of vaccine that is available prevents them from vaccinating a larger number in the population. Let us remember that the immunization program in Nicaragua is a very sound program, and they are acting according to the plan. So regarding the question of what people should do or how should they protect themselves when they receive the vaccine, well, in fact, those who receive the first dose or even those who receiving the second dose, they should continue to keep their protection measures, as has been repeated already by Dr. Barbosa, the director, and Dr. Alighieri. It means we need to continue to implement physical distancing, hand washing, wearing masks. And this is, of course, not only to protect those who have been vaccinated, but the rest of the population as well. Of course, there is evidence that it is necessary to continue to implement those public health measures up until the time that a significant amount of the population has received the vaccine. Thank you. Thank you, doctor. And we are coming to the end of today's media briefing. The next question is from Ares Yesca from Agencia EFE. And it reads this, it's been a year from the first case detected in Brazil and in Latin America. The question is, how can we summarize what is the balance for the last 12 months?
So this past year, the COVID-19 pandemic put our region to the test, without a doubt. It pushed our health systems to the brink. It challenged our economies and forced our societies to alter their way of life just to stay safe. We've also suffered immeasurable loss, but we have shown, and that's very important to note, we have also shown more resiliency, ingenuity, and solidarity than at any time in our history. I firmly believe that our region will emerge from this crisis stronger than we were before it started. And as I look back, I would say there are 4 big lessons that stand out to me that I hope we can carry with us into the next few months as we continue our long fight against the virus, and also into the future as we prepare for the next crisis. First, our COVID-19 response has been strongest when it has been guided by data and science. Places that had effective monitoring of cases and hospital occupation, and that use this information to guide the application of their public health measures, were able to control transmission much more effectively and quickly. When we base policies on data and science, we save lives. Second, public health is a global concern. COVID-19 showed us that a deadly virus that emerges halfway around the world can be a threat to anyone, anywhere. Third, access to quality healthcare should be universal. The pandemic has been a deadly reminder of the inequality in our region. Where you live or how much money you have should not determine whether you live or die from COVID-19 or any other disease. And fourth and final, health is central to economic and social development, and we must invest in it. Thank you and keep safe.
Muchas gracias, doctora Etienne. Ahora sí hemos llegado
Thank
al
you,
final.
Dr. Etienne. This is the end of our today's session. Thank you all for connecting with us, and you can find more information on PAHO's webpage. And please keep in touch by email. And again, goodbye, but we will see you next week.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.